Do chiropractors treat knee pain? If you've been struggling with knee pain for over 3 months, you've tried medication, exercises, NHS physio, and it still hasn't gotten any better, then it may be time to look at something different. Rather than just plugging away at the knee, there's many other things that can be causing knee pain. So my name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey, and we help people with chronic low back and knee pain avoid a lifetime of painkillers and surgery. So if you've been struggling with knee pain, whether from an old injury, arthritis, or just daily wear and tear, chiropractic could be the missing link in your recovery. So what we're going to go through today is that myth-busting thing about chiropractors not treating knee pain. So I want to show you exactly why knee pain happens and show you how chiropractic care can help. So why don't people think that chiropractors treat knee pain? This is the age-old myth. So most people associate chiropractors with spinal adjustments, and we just deal with back pain and sciatica. And largely that is true, but we also focus on spinal health because it plays a huge role in the overall body function. But here's what many people don't realize. The spine controls every single joint in the body, including the knees. Through the brain, through the nervous system, everything goes from the brain and spine. So chiropractors are great with biomechanics, how the body moves as a whole, not just the spine. And many knee problems are actually caused by issues in other areas like the hips, the pelvis, or the foot. And chiropractors are great at finding these root cause issues. So if you've been dealing with knee pain, only focusing on the knee itself, then you might be missing that bigger overall picture. So how does knee pain actually happen? What are some of the common causes that chiropractors can help with? So knee pain isn't always about the knee. Often it's the result of problems elsewhere in the body. So here are some of the most common causes of knee pain that we treat. First one is poor hip and pelvic alignment. So when the hips or the pelvis are out of balance, it puts uneven pressure onto the knees. This can lead to pain and inflammation over time. Number two is foot and ankle issues. So flat feet or overpronation or a previous ankle injury can change the way that you walk, causing more stress on the knee joint. Number three, muscle imbalances such as weak glutes, tight hamstrings, or overworked quadriceps can pull the knee out of alignment. And in number four, osteoarthritis and wear tear. Chiropractic care can help improve knee joint mobility and function, reducing stiffness and pain over time. And then lastly, number five, previous injuries, things like ACL tears, meniscus damage in the past from a sporting injury. Even if the injury is healed, improper movement patterns can linger, causing ongoing pain, dysfunction through that knee joint. So how do we actually treat knee pain? So now that you know that chiropractors can help with knee pain and also why we help with knee pain, let's talk about how we actually do it. So at West Chiropractic, we are famous for treating the body as a whole, a very holistic approach to identify the cause of any pain, not just knee pain. And we don't just want to look at the symptoms, we want to find the root cause. So chiropractic adjustments, they're not just for the spine, it's for your pelvis, your lower back, your ankle, your knee joint, your fibula. If it's misaligned, it's going to throw off your knee mechanics. So by adjusting these specific areas, we restore proper movement and take pressure off the knee joint to help it mobilize and transfer the weight from the pelvis down the knee. We do knee joint mobilization. So gentle mobilization techniques improve the joint movement, reduce stiffness, and help with long-term pain relief. Soft tissue therapy, muscle imbalances often contribute towards that knee pain. So we use things like myofascial release, Graston, active muscle therapy to relax those tight muscles around the hips and knees to improve mobility. We do rehabilitation exercises. You see me do lots of knee rehab exercises here to help strengthen the glutes, the quads, the hamstrings and calf muscles to support the knee and prevent future issues. You see me do things like glute bridges. They're going to strengthen the hip to offload the knee. Step ups, just one-legged, to help balance the pelvis and help with the knee stability. And calf raises, they help support the knee function by strengthening the lower leg. We also carry out foot and gait assessments. So we want to assess how you walk and move to identify any biomechanical issues. And if needed, we might recommend some orthotics. We've got Ollie here who prescribes all of our orthotics to help with specific exercises to improve that foot stability and reduce the strain going through your knee. So orthotics really are a fantastic way to get your pronation fixed or any flat foot fixed, because they provide that support that the foot needs, and it means that knee is not going to roll in. It's going to take a lot of pressure off that area. So it's a great thing to get sorted. Even if you don't buy orthotics, I would always say just get an orthotics assessment, get a gait assessment to understand how you're walking and why you're walking in that way. So when should you see a chiropractor for knee pain? Because it's not always the first port of call. We understand that. Usually when you have knee pain or a sports injury, it's go to the physiotherapist or go to the GP. GP will then prescribe pain medication or NHS physio. NHS physio, they're so stretched at the moment, so under-resourced, you're not always getting the care that you need and deserve. So private physios, they are great. But sometimes, like I said, it's not always the knee that's causing the problem. You need to look a little bit outside. So worth having a chat with a chiropractor to see if they can help. So if you're experiencing any of these signs, then it's worth reaching out to us or another chiropractor in your area. So if you've got knee pain that won't go away despite rest or stretching, number 2, pain that worsens with activity like running or going upstairs. Number 3, stiffness or swelling in the knee. Number 4, clicking or a grinding sensation when moving your knee. Number 5, pain that started after an old injury and never fully healed. So if any of these sound like you or familiar, then a chiropractic assessment could help pinpoint the underlying issue and get you back to that pain-free movement. So don't dismiss chiropractors. I'd always say there's some really, really valuable resources, some great chiropractors out there. Can be one of the best kept secrets for helping with knee pain relief. By addressing that root cause issue, whether it's in the hips, the spine, the feet, or the knee itself, we like to pride ourselves in knowing that we can help you feel better, move better, and prevent long-term issues. So thanks for your time today. If you liked the video, please hit the like button. Please subscribe to the channel for our regular weekly updates. And as always, you can grab copies of my best-selling books, The Secret Cure to Back Pain and How to Transform Your Back. Thanks a lot. We'll see you next time.